This is Tom Bernacki, and today I'm here with Jonathan Gasso from PARC Skilled Home Care, and we're going to be talking about a question: how long does Medicare pay for home services? Jonathan, you're the expert in the area. Go for it.
Yeah, so when a physician writes a script for home care services, that script is deemed it's eligible for 60 days. So a lot of times people think that they can only receive services for 60 days. But the really nice thing about what Medicare believes in is that if a patient, it's deemed necessary, that they may need more skilled services beyond 60 days, what they allow is for a recertification for another 60 days. An easy example of that is if there's someone with a wound that needs tending to. That may not heal within 60 days, and so our nurses will continue as long as it's justified and it's documented appropriately. We technically can be on services for as long as there's a medical justification. So 60 days is the time frame, but we can always extend by 60 days.
There are criteria for qualifying for Medicare coverage. You need doctor supervision. That means a doctor needs to be seeing you and writing prescriptions for your home care and must recertify it. So it's not indefinite. It's up to 60 days, and you must be reasonably homebound. So this is kind of not meant to be tricky, but technically everyone could make it to the doctor's office and not be homebound if an ambulance and 6 people picked you up, for example. But this must be at least reasonably homebound, so it's difficult. And Medicare covers intermittent skilled nursing. This means 1 or 2 or maybe 3 visits a week maximum for a short period of time. Some physical therapy, some occupational therapy, speech services, social work help, for example, to see if you qualify for nursing home placement or memory care or some other help, some aid to help wash you occasionally, but that's once or twice, and durable medical equipment. Durable medical equipment is things like walkers, braces, wheelchairs, potentially a hospital bed, but again, this requires physician certification and lots of visits. This is what makes it tough. People generally need a lot more than this, especially if they're homebound. They might need somebody for 4 hours, 8 hours, 12 hours, or even 24 hours. And this is where private duty home care services come in. These are not covered. So for example, if you have an aide helping you out for longer periods of time, more than like say 15 or 20 minutes a couple times a week, then this would be private duty home care. Generally, companies like Assisted Cans, Home Care, do provide these services. It's considered private duty home care. There are ways to get this covered, and click the show notes or this link for the book we wrote on how to get this stuff covered in Michigan or the United States. And the big thing from my end, I do a lot of wound care for the home. Companies like Jonathan's PARC Home Care, realistically, a wound will not heal in 1 month. So a lot of the people at home that need wound care, on average, even if everything's going perfectly, a wound closes maybe 50% in a month. So it can sometimes take 3 to 6 months or more to heal a wound. Same thing with a broken leg, a broken foot, a motor vehicle accident. We're talking months. Would you be able to help people out like that if the doctor are recertified?
Absolutely. If there's a justified need, which it helps when the physician also sees there's a medical need for it, we will go in there and we'll carry out the prescription that the physician wants us to do, and we will service that patient, whether they need therapy or they need nursing services. We could carry it on.
Yeah, and I think just in the meantime, a doctor has to write a certificate or the script, but see you in person. So sometimes, Jonathan's company can get people out to see you guys in the Metro Detroit area, or you can make it in a clinic every once in a while to get checked on your progress and make sure it's doing good.
Right.
Great. So if you need more than 1 or 2 visits a week, consider a company like Assisting Hands, which is us at Michigan Personal Care, and we can provide you with a well-matched caregiver. So this is stuff that covers homemaker services, personal care, bathing, dressing, using a bathroom, medication reminders, stuff like getting food, making sure the house is kept. If you're a single person living out in the country, we can check on you, we can help out. Or if you need a parent checked on, a couple times per week can be set up. Or even if you need help getting to surgery or doctor's follow-up appointments, needs, we can help with that. So that's Assisting Hands. These are the areas in Michigan that we serve. If you or your loved one have somebody in this area, give us a call and we could go over some of the details with you. Or if you need help covering them, we have a book that goes over how to pay for private care in Michigan.
And the one thing is, we talk about this in some of our other videos, but skilled home care provides things like physical therapy, occupational therapy, wound care, specialists like dietitians that can come out, nurses that can come help you. There is a difference though. If you need somebody there permanently, like 8 hours a day, 12 hours a day, or maybe 4 hours a day to help you get to your appointment and give you a ride, that's where private pay home care services can come in. And we include some links down in the show notes. Assisting Hands is a great one that we work with here. And Jonathan, thanks for answering the question. His info, if you need great skilled nursing in the Metro Detroit area, click down below. His info will be there. Thank you.
Thank you.
If Medicare does not cover the services you need, so more than just intermittent or occasional visits for like 15 minutes, then click to download this book. These are services to help pay for private duty care and extra care in Michigan. So this is Medicaid, Medicare, VA benefits, the Michigan Link program, financial options with reverse mortgages, financial planning, that kind of stuff. So if this video helped, click below for the free book, or click to watch more of our home care guides and subscribe. We'll have great videos coming for you.